Hello and very good evening, everyone. So, welcome to Unacademy. So, let's get NEET PG. Myself, Dr. Muskan Chaudhary, and today we'll take the Ultra Revision of the immunity, antigen, antibody, and the reactions. All right. So, starting with Unacademy has access to both the live and the recorded sessions, and you get to learn from the India's topmost educator for any medical examination and compete in the live T&Ds with the highly competitive quizzes and the scholarship programs that are being provided by the Unacademy on the platform. Study on the device of your choice and assess up to 25,000 of the MCQs with printed and the digital notes. Now, under Icon subscription, Prep Leader has come together with the Unacademy, where clinical and integrated essentials with video lectures, QBanks, and rapid revision snapshots and Dream Notes with where structured live batches, recorded classes, and QBanks up to 25,000 of the questions with competitive T&Ds and the printed and the digital notes. Under a plus category, we have around 36,000 rupees plus category program that is accounting for 1500 per month for 2 years, and for 3 years it is 1250 per month, and for 18 months it's 1625 per month. Under iconic one, we have for 2 years it is 2438, and for 3 years it's 1875 per month, and for 18 months it's 2875 per month. Alright, so accounting for 58,500, and please do use code that is Muskan10 to get 10% of the discount. Now, raise a hand. That is something you get to personalize your classes and make it more interactive with one-on-one interaction with your favorite educator, and drive engagement with just by raising your hand. With highly effective Q banks and based on the latest examination patterns, and use code that is Muskan10 to get 10% of the discount. Interactive live classes under special classes, and we can do the polling for the same. Raise a hand and never miss a class, because you will do get the notification for the same, and you'll get notified for the lessons and the lectures, and download the lecture notes and get access to the recorded sessions anytime and anywhere, and attend the live classes. So we'll start with the immunity. Okay, so where are we? Starting with the definition of the immunity, starting with the definition of the immunity, which is defined as the resistance that is offered by the host against the microorganism or any foreign substance. Now, it is basically immunity is of two types. One is the innate immunity that is inside us already, that is from the birth, and another one is what adaptive immunity or the acquired immunity. All right. Now, starting with the innate immunity. Now, innate immunity is actually an inborn immunity, that is an inborn resistance against the infection that an individual possesses right from the birth due to his what genetic makeup and the constitutional makeup. All right. Innate immunity has certain properties when compared with the other immunity that is acquired one. Now, one is that since innate immunity is already present inside us from the birth, and it will act in what in minutes. It will act in short period of time. That it is because it is the first line of the defense, and when the exposure has not been done yet by the body, and it is inborn, that is immunity, it will act just within minutes, and it is what the first line of the host defense against any infection. Alright, so that is what it is, the first line of the host defense, and it will act in minutes. Next is the prior exposure is not required for that, because innate immunity is the independent of the prior exposure, and it is already present in us before the exposure to any of the antigen microorganisms, so that is not required. Diversity is limited. Why? Because it is active only against a limited antigens, therefore diversity is limited. It is non-specific because it can be directed against any organism. No memory is present because due to what, that is, the antigen exposure is not there and the acquired immunity is not taking part, and innate immunity doesn't have a memory component. Alright, so whether we have the repeat infection with the same antigen, in case of the innate immunity, it will always have primary response, no secondary response. और इस secondary response was present जब हमारे पास pale exposure हो चुका and memory cells are present which recognized the antigen and would have presented with the secondary response. But primary response will be present every time when the antigen is exposed to that of the innate immunity. Now, moving next, what is the mechanism of the innate immunity? Now, mechanism, receptor interaction following the exposure to the microorganism. Several mediators are recruited at the site. Now, the first step that takes place is attachment, which involves the binding and to the receptors of the cells of the innate immunity. Now, one we have is MSM. What is that? It is microbial surface molecules. It is microbial surface molecules, and they are what? They are repeated patterns of the molecules which are common to the most of the microbial surfaces. So this is the bacteria, and here we have the MSM, that is the microbial surface molecules that are what, recognized by the immune cells. So examples of the MAMs includes the peptidoglycan, LPS, lipoproteins, and the teichoic acids. Next, this was the MSM, that is a microbial surface molecules. Next, we have the pattern recognition pattern. Now, these are the molecules that are present on the host cell, like the immune cells, जैसे कि phagocytes that recognize the MAMs. Okay, these are microbial surface molecules which are recognized by the pattern recognition receptors. Toll-like receptors are the classical examples. Toll-like receptors are the classical examples of pattern recognition receptors named after the fruit fly. That is what? That is the Drosophila. Alright, and signals generated following the binding to MAMS activate the transcription factor that stimulates the gene encoding the cytokinase enzymes, causing the activation of the immune system. So, nothing, the pattern recognition receptors recognize the MAMS that are present on the microbial surfaces and activate the immune system. Now, coming to next is what? The components. Now coming to the components, now there are several mediators of the innate and acquired immunity, and so several mediators which act as a bridge between the innate and the acquired immunity. Alright, some mediators are not purely part of innate, some act as a bridge, that is what complement and the macrophage. Now coming first to the anatomical, to the components of the innate immunity. We are talking about the components of the innate immunity. One, first we have the anatomical and the physiological barriers. Anatomical barriers जैसे कि we are having the skin and the mucosal surfaces have a spectrum of the antimicrobial activities. Then we have the physiological barriers, and then we have what, the phagocytes. Now phagocytes such as the neutrophil, macrophage, they include are the main component of the innate immunity. Alright, and what are the steps that involve? That is the engulfment of the microbes causing the phagosome to form the phagolysosome and the killing. So we are having the anatomical barriers and then the physiological barriers. Important component is of the innate immunity that is asked is what? NK cell. Once we had what? Anatomical barriers. NK cell. Now NK cells are nothing. They are the lymphocytes that are directed against to kill the viruses and the tumor cell and the tumor cell. Alright, so please remember NK cell against the virus and the tumor cell. Other we have the T and B lymphocytes. Although T and B lymphocytes are the major component of the acquired immunity, but there are several types of the lymphocytes that shares the features of both acquired and the innate. Now, one is the gamma delta T cells, one is the NK T cells, one is the B1 cells, and the marginal zone B cells. Alright, so that is the gamma T cells, NK T cells, marginal zone B cells, and the B1 cells. Now, next is what we will talk about the mast cell. We will talk about the mast cell. Now, mast cell are present in the till now we have talked about the NK cell, we have talked about the anatomical physiological barrier and the phagocytes, NK cells and the atypical B and the T cells, that is about the delta T cells and the NK T cells and the marginal zone B cells. Now we'll talk about the mast cells. Mast cells are present in the epithelial lining of the respiratory and the other mucosal cells, and they are activated by the products binding toward toll-like receptors or by the IgE antibody dependent mechanism. They release abundant granules rich in the histamine, serotonin, cytokines that initiates the inflammation. So that is what we are talking about the mast cells. Next we have is the dendritic cell. Okay. Dendritic cells, they respond by producing what? The cytokines. Now, they also serve as a vehicle in transporting the antigen from the skin and the mucosal site, as they serve as a bridge. So remember, dendritic cell act as a bridge between the innate and the acquired immunity. Now, some basic difference between the innate and acquired immunity. Innate is the immunity that is already present from the genetical constitution. Adaptive or acquired is that is one acquires during the lifetime. Now, innate is obviously the natural one and it is acquired one. Innate has the non-specific action and it is always present in the body and generates a rapid response that is within the minutes. We've already seen that, and does not develop the memory cells. Temperature, pH skin are the barriers, and the phagocytes, physical and chemical barriers are the components. Less potent and doesn't produce the allergic reactions. Now coming to the complement pathway, now we have two types of immunity. One is the innate one and the acquired one. So complement pathway one is the alternative pathway and the Mannose binding pathway, while the classical pathway is a part of the acquired immunity. Important in generalized, a generalized question is being asked that complement pathway is a part of the which of the pathway, alternate or the classical, then we'll go with what the innate immunity, that complement pathway is a part of the innate immunity. But if specifically asked, that classical belongs to the acquired one and the alternate and MVP to the innate one. So it is acting as a bridge. One bridge we have already seen is the dendritic cells and another is the complement pathway. So complement pathway is activated in response to the endotoxin, whereas the MVP is stimulated in by the mannose carbohydrate residue on the surfaces. Now, complement mediates various biological functions, that is the lysis of the target microbe, stimulating inflammation and stimulating the acquired immunity, therefore acting as a bridge between the innate and the acquired one. Now, coming to the inflammatory responses. Yes, coming to the inflammatory responses, inflammation is defined as a biological response of the vascular tissue to that of the stimuli. That is microorganism and the foreign substance. The major events, first the vasodilation, then the leakage of the proteins and the recruitment of the phagocytes. And this you must have read in the pathology, that margination, rolling, extravasation, then chemotactic migration, then engulfment of the organism. Then we have the normal resident flora that also act as a part of the innate immunity and protect the body. So that is lining the intestinal, respiratory mucosa and the genital tract, and they compete with the pathogen for the nutrition, therefore, and also produce the antimicrobial substances. Next we have is the cytokines. Now in response to microbial antigens, dendritic and macrophage, other several cytokines mediate the innate immunity, that is the TNF alpha, interleukin 1, 6, 8, 12, and 16. interferons alpha and beta, and transforming growth factor beta. So remember TNF alpha, TGF beta, interleukins, and the interferons alpha and beta. Next, we have part of the innate immunities, acute phase reactant proteins. These are important. They are what from the name? They are proteins that are synthesized mainly which site? That is the liver. That is the liver. But apart from the liver, we also have other various sites. That is what endothelial cells, fibroblast, monocyte, and what adipocytes. Now, positive APRs are the proteins which level increases during the acute inflammation. And we have to remember the list of the APRs, that is the complement proteins C1 to C9, factor B, D, and properdin. Then we have the coagulation proteins, proteinase inhibitors, alpha-1 acid glycoprotein, and the metal binding proteins. Remember the negative one. You can easily remember the positive. We have the mnemonic for the negative one that we'll see. Now, negative APRs. What are negative APRs? Whose level decreases during the acute inflammation, thus creating a negative feedback so that it stimulates the liver to produce more positive APRs. All right, and we have to remember that is the Tata, that is TA is what the transferrin, then we have albumin, and we have the antithrombin. These are what? These are what the negative APR. That is, we are having what? Transferrin. Then we have A for albumin, and another T, that is what? Antithrombin. So transferring antithrombin and the albumin. What is the role? What is the role of the APRs? Now they contribute to the host defense, and they have what? Antimicrobial and anti-inflammatory activity. Alright, metal binding proteins can chelate metals and making them unavailable for the bacteria. So this is the negative one, albumin, transferrin, and the antithrombin. And these are the positive ones, CRPs and the ceremoid hepatoglobin, ceruloplasmin, alpha microglobin, fibrinogen, and the complements. Next, we have the C reactive protein. C reactive protein is nothing. It is a APR, that is acute phase reactant proteins in the inflammatory conditions, and it belongs to beta globulin family. Alright, CPR is named because it precipitates what? The C carbohydrate antigen. From the name that it precipitates the carbohydrate antigen of the pneumococcus. However, it is not an antibody against, it is non-specific, and it can be raised apart from the inflammatory conditions. It can be raised in other non-inflammatory conditions like exercise and the pregnancy. Now we have to remember the CRP level, that the normal CRP level is less than 0.2 milligram per deciliter, and there is insignificant rise between 0.2 to 1 milligram per deciliter in case of the cold, exercise, or the pregnancy, and 1 to 10 milligram per deciliter in the bronchitis, cystitis, and the pancreatitis. More than 10, that is condition occurring in the major trauma and the vasculitis and the bacterial infections. Now, methods to detect can be detected by the precipitation method, and next can be detected by the latex agglutination, using the latex agglutination test. Now coming to the next one, that is the acquired or the adaptive immunity. Yes. So now we come to the next type of immunity, that is the acquired. Yes, so acquired or the adaptive immunity. Now, from the name itself, acquired immunity, that is the resistance against the infective organism, has been acquired or has been adapted by the person during the course of his life. So, it can be differentiated by the immunity by the various steps, various points. That is, one is that T and B are the T and the B cells are the major mediators, and another is that what are the other components of the adaptive. There we had the alternative complement pathway in the MVP. Here we have the classical complement pathway, and we have the APCs, antigen presenting cells, that presents toward the T cells, and then we have 245 interleukins. Remember, interleukin 2, 4, and 5. All right, response against takes several. There in the innate immunity, if you remember, the response took within the few minutes, and here it will take several days to weeks. Here, they require exposure to the microbes, so they are highly specific, and therefore, primary and secondary immune response are present, and secondary immune response is more than the primary immune response due to the presence of the mammary cells, and it is more potent. Therefore, acquired immunity has the mammary component. Why it happens? Therefore, because mammary component is present, therefore, primary and secondary immune response is taking place. Diversity is wide for the obvious reasons, and the host cell receptors are specific. There we had the non-specific because the innate immunity is not a specific one, and the acquired one is a specific for the antigen. Now, acquired immunity is further of two types. One is either active and the passive one, and another is what artificial and the natural one. So, coming to the active immunity that is actively formed by the body. So that is the active part of the immune system is taking place. All right. So active can either be natural or the artificial. Natural is for obvious reason that the natural infection has taken place, and artificial active immunity can be made after the vaccination. So therefore, when the person has been vaccinated, the primary exposure of the antigen has been given. Secondary exposure will be more strong enough and the potent for the same disease. Therefore, we have artificially induced the immune system of the person. So active immunity is both natural and the artificial one. And we have the active immunity that is lasting for the longer periods, but the duration varies depending on the type of the pathogen. It may be lifelong and it may last long when the microbe is present. Now, next is the primary immune response. First, we had the active immunity in which we are having what natural and the passive, and natural and the artificial one. Artificial by the vaccination, natural that is naturally after the exposure to any type of disease. Now, moving next. So, coming to the primary immune response. Now, when the antigen, what is the primary immune response in the active immunity? When the antigen has exposed for the first time to the body, it is what primary immune response. It have the latent to the lag period. What is that latent to the lag period? From the name, that is a lag period. The immunity develops only after a certain period of the time after the exposure of the antigen has been done. Because why? During that time, the host immune system is actually becoming active and forming the cells against that antigen. Effector cell, the T and the B cells are the effector cells. T cells form the helper T cell and the cytotoxic T cells. And the B cells will form what? Antibodies and the memory cells. Alright. Alright. Now, effector B cells, that is the plasma cells, forms the memory B cells, and the minor proportion will become of stimulated T and B cells become what? Memory cells, and which is the reason for the secondary immunity. Then we have the antibody surge. Effector B cells produce the antibodies and reach the peak, maintain the level for a while, and then falls down. So this is very important graph. This is the primary immune response, and this is the secondary immune response. So what are the points that we need to remember? First thing is that कि सबसे पहले you see this is the lag period. All right. So this is the lag period or the latent period during which any antibody has not been raised. Only the bodies is taking some time for its immune system to make it active. This is the lag period. Then we have the first antibody that is rising, that is IgM, and later the IgG, and further the baseline. The antibodies will touch the baseline. Now, come to secondary immune response. If you see, first antibody to be rising is what IgG, and there is what a constant concentration, high concentration of the IgG in the serum, while IgM will falls down. So IgM has the active role in the secondary immunity, and therefore secondary immunity, if you see, the lag phase is very small or either absent. So it is more potent and more active than that of the primary immunity. Also, the antibodies concentration is way larger than that of the primary. Therefore, we say that the booster dose of the vaccine, the booster doses of the vaccine are more effective than actual vaccination. All right, because of the secondary immune response. Now, coming to the secondary immune response, when the antigen exposure has occurred subsequently, the event will takes place. That first is that secondary immune response. We've already seen that the latent period or the lag period is absent or very small. This is because the memory cells soon becomes active just after recognizing the antigen. Now, negative phase. What is a negative phase? Now, we saw that the latent or the lag phase is completely absent or very short. Then we have the negative phase. Now, first the primary exposure had taken place. Then the body forms some antibodies. That antibodies are left in the serum. And when subsequent exposure will take place, again these antibodies will be consumed and sudden fall in the serum will take place of the antibodies. So that is a negative phase, and during which although the body is making the antibodies, but during that phase, the serum antibodies will actually decrease in the concentration at a certain level. So this is a negative phase. That is, at the onset of a secondary immune response, there may be negative phase during which the antibodies level may become lower than it was before the stimulus. This is because the exposed antigen combines with pre-existing antibodies, and thus the antibodies serum in the serum actually falls down. Next is the antibody surge. Antibody surge in the secondary immune response is way more potent, way more in concentration compared to that of the primary immune response. So, secondary immune response is what it refers to the immune response system that includes the production, and it is a subsequent exposure. All right, and comparisons we have already done. Now coming to the active and the passive immunity. Now active and the passive immunity is for the active immunity, the type of immunity produced by the reaction to a vaccine, and vaccination is a kind of what active immunity, and antibodies that are produced by the animals injected in the bloodstream and through the mother, that is what the passive immunity. We'll come to a table once we are done with the we'll compare the tables when we are done with the passive and the active immunity. Next, we have next we have is the passive immunity. Okay. Now, what is that? Passive immunity is defined as the resistance that has been offered to a host passively. That is what ready-made immunity. Alright, passive immunity can also be included naturally and artificially. Natural passive immunity, that is from mother to baby. Okay, that is the IgG antibody transfer from mother to the fetus during the placenta. Next we have is the artificial passive immunity that develops following the ready-made transfer of commercially prepared immunoglobulin that we see in the rabies. Passive immunity plays a very important role in the immunodeficient individuals and the post-exposure prophylaxis. Now, passive immunity is of now we already seen that is either naturally and we are giving it artificially. Two types we saw, that is a natural and artificially, and passive immunity, that is a ready-made immunity. So it will be what faster and there is no lag phase or the negative phase because they are already ready-made one. And since they are ready-made ones, there is no immunological memory will be present in that. Okay, booster dose are not effective as memory cells are not there, so memory cells has no part in the immunity, so no booster dose role is seen in case of the passive immunity. Now we'll talk to some of the bridges between the innate and the acquired immunity. Bridges between the innate and the acquired immunity. Now, when we talk about the bridge between the innate, there are several cells and a part of the immune system that act as a bridge. The innate and the acquired immunity do not work independently, rather than they function in a highly interactive and a collaborative manner. Certain immune components play important role in the both the type of immunity. Examples include what we already saw, macrophage and the dendritic cells. Macrophage and what? Dendritic cells that belong to the innate as well as the acquired immunity. Alright, and ADC, that is antibody dependent cell made toxicity, is a type of CMI. Next we have the complements. In the complements we already saw that the complements, the classical belongs to the this active immunity, and the Menos binding and the alternate belongs to the innate type of immunity. Then we have the cytokines, that is the actually from cells of the innate cells may activate cells of the adaptive immunity and the vice versa. And if you remember, the cytokines interleukin 245 was belonging to which type of immunity? That was active immunity. Now, rare class of the lymphocytes we already read that gamma delta T cells and the NK T cells. Then we have the Magellan zone B cells, and they take these cells have main characteristics that place them in the border of the innate and the acquired immunity. The function is in the early defense against microbes, a part of the innate immunity, although their receptors are encoded by the somatic recombination of the genes. Now, moving next. Now, moving next, what are the other types of immunity? One is what the local or the mucosal. And if you remember, it is due to what type of antibody, that is the IgA antibody, which prevents the entry of the microbes at the local site. So, it is the immune response that is active at the mucosal surface, such as intestinal, respiratory, or the GIT mucosa, and it is due to the secretory IgA antibody which prevents the entry of the microbes at the local site itself. Now, local immunity can also be induced by the natural infection or by what? The live vaccination. For example, following the oral polio vaccine, that is OPV, and secretory IgA antibodies are synthesized in the mucosal layer. That is, a secretory IgA antibody is responsible for the local immunity or the mucosal immunity. Next important immunity is we are having what herd type of immunity. You must have read this about in the PSM as well. So this is herd immunity, that is the overall immunity of a community or a group towards a particular pathogens, and this plays a very important role in breaking the transmission and the breaking the transmission of any epidemic disease and breaking the life cycle of any epidemic disease. So if herd immunity is good, this means large population of a particular community are immune towards a particular pathogen. Hence, epidemics are less likely to occur and eradication of that organism is possible. So, occurrence of the clinical and the what are the factors that are contributing to the herd immunity? That first is what occurrence of the clinical and the subclinical cases, and second is that the ongoing immunization program, herd structure, that is the type of the population that is involved in the herd immunity. Now, next is the type of the pathogens that is involved. That maybe pathogen, the herd immunity may be strong in a community against all the pathogens, and it develops effective vaccination. Herd immunity develops effective vaccination, like in the case of the diphtheria and the pertussis vaccine, MMR and the polio. So, depending on the clinical subclinical cases, ongoing immunization program, and what is the structure and what is the pathogenicity of the organism. Now, adapt. Now, next is what we are having, the adoptive immunity. This is special. This is a CMI type of cell-mediated type of immunity which develops following the injection of the immunological competent T lymphocytes. And useful for what type of disease, that is lepromatous leprosy, adoptive immunity is used. Adoptive immunity. Now, moving next to the next topic, that is antigens. Now we'll discuss some few important points about the antigens. Uh, for the list of that vaccines, okay, I'll just tell you the list for the vaccine for the this live and the killed vaccination. So first we'll talk about the live attenuated vaccine. Now where do I write? Here I write live attenuated vaccine. We have important one, that is the BCG. Then we have oral typhoral vaccine, that is the oral vaccine on 135 days, and on the seventh day the effectivity starts and the booster is given at the fifth year. Next we have the OPV. Next we have is the येलो फीवर. एंड व्हाट एल्स वी हैव येलो फीवर के साथ हमारे पास मीजल्स है, मीजल्स मम्स, दैट इज द MMR. देन वी हैव द चिकन पॉक्स एंड द influenza vaccine and the epidemic typhus vaccine. Important ones are the BCG, OPV, typhoral, yellow, measles, mumps, rubella, chickenpox, and influenza. Now, next we talk about the inactivated or the killed vaccines. Okay, so that is also typhoid is also having the inactivated vaccine, and one is the cholera. Then we have in the plague, important one to remember is the rabies, and the polio, that is the Salk vaccine, the polio one. Then we have the hepatitis B, hepatitis A, and Japanese encephalitis and the forest disease where pig is the reservoir, and Japanese encephalitis. Japanese encephalitis is important one, KFD, hepatitis A, B, Salk, polio vaccine, rabies, plague, cholera. Alright, so these are what? These are the inactivated killed vaccine. Then we have the toxoids. In case of the diphtheриal toxoid, and what is tetanus toxoid? Okay, so hope you made the list for that one. Now moving next is the antigen. Now, to the antigen, antigen is defined as any substance that satisfied two properties. One is the immunogenicity. One is what immunogenicity, and the next one is what antigenicity. Okay. So what is the difference between the immunogenicity and the antigenicity? Now, immunogenicity is the ability of an antigen to induce the immune response in the body. Antigenicity is the ability of an antigen to combine with the final product of the above two responses. So, immunogenicity is the induction, all right, and the ability of an antigen to combine with the antibody. Although immunogenicity may antibody ban gaya, and memory T cells and all they are formed. But if they are not able to react with the antigen, then it is the antigenicity. Okay? So induction of the immune system, formation of the antibody is actually immunogenicity, and the ability to act with that antibodies and the this cells, memory cells, T cells, cytotoxic T cells. This is what antigenicity. So that is, it is the ability of an antigen to induce the immune response, and it is the ability of antigen to combine with the final products. The substance that satisfies the property is first property is the immunogenicity, and is more aptly called as the immunogen. So someone calling an antigen as the immunogen, that is, it only has the ability to induce the immune response to form the antibodies and the memory cells, but it doesn't has the ability to that of the combining with that. Now, all the molecules have the immunogenicity and also shows the antigenicity, but the reverse is not true. All right. So, every antigen that is having the capacity to form the immune cells, but may or may not have the ability to bind with that. Example, haptens because they are incomplete antigens. The reason being that they are antigenic, but they are non-immunogenic. Now, coming to the next, that is the epitope. Now, epitope or the antigenic determinant is the smallest unit of the antigenicity. It is defined as small area present on the antigen comprising of the 4 to 5 amino acids that is capable of sensitizing the T and B cells. So, nothing, it is the smallest unit of the antigen. So, epitopes may be grouped into two types. One is the linear one, and another is what? The conformational one. That is the flexible. They are found in the flexible region of the complex antigen. Next is what we are having the complex. That is the next we are having the is the haptens. So next we are having the haptens. Now haptens क्या है? Low molecular weight molecules. ठीक है, so they are low molecular weight molecules that lacks the immunogenicity. That is, they cannot induce. Remember, I say I, that is, they cannot induce the immune cells, but they can combine, they can bind to the specific antibodies. So what happens? They are what part of the, they are incomplete antigens, and they are not having the immunogenicity, that they cannot induce the immune system. They can just combine with the specific antibodies, that is, they are antigenic only. Now, haptens can become immunogenic when combined with a larger protein molecule that is called carrier. So that is, haptens can become immunogenic when combined with the larger protein molecules that is called as a carrier. And haptens may be classified into two, that is the complex and the simple one. Complex that contains two or more than two epitopes. Alright, and the simple one that usually contains one epitope. Alright, so a complex that is two or more epitopes, they can react with specific antibodies and form the haptin antibody complex. So this is a carrier molecule. To completely make the hapton typical antigen, we have to combine with the carrier molecule, that is majorly protein, and then a complete antigen will be formed having both the immunogenicity and the antigenicity. Now, by itself, haptin cannot function as an immunogenic epitope, but when multiple molecules of a single haptens are coupled to carrier, the haptens become accessible to the immune system to induce the immune system and to activate the immune system to form what the. Now, coming to the antigen host relationship. So, antigen host relationship, based on the antigen host relationship, antigens can be grouped into two groups. Now, one is what that is the self antigen or auto antigens. Okay, self antigens, that is belonging to the host itself, hence they are not immunogenic. Host immune system doesn't react with its own antigens, which is due to exhibiting mechanism, that is the immunological tolerance. Sometimes the self antigens are biologically altered, then it will cause autoimmune disease and they become immunogenic. So these are what the self antigens or the auto antigens, which is the of the host itself and they doesn't react with the host immune system. Next is the non-self or the foreign antigens. They are immunogenic and are of three types. One is what the allo antigen. Next is what we are having the iso antigen and the hetero antigen. Okay. So allo antigens, that is the species specific. That is the allo antigen. Then we have the iso antigen, which is present in the subset of the species. Like in the blood group antigens, the histocomparative antigens are highly specific as they are unique to every individual. Next is a hetero, that is to two different species. Now, coming to the next very important, that is the heterophile antigen. Okay, so heterophile antigens are a type of the heteroantigens that are present in two different species, but they have something common and they share and a part of the antigen, and that is the epitope. So they share what? They share the epitopes. And because of the sharing of the epitope, if antibody is formed against one epitope that is similar to that of the epitope of the another species, so this will cross react. So this is the cross react, and therefore heterophile antibody test like the wheel Felix test and Polygrinal test are helping us and diagnostic for the various disease. So heterophile antibodies can used in several serological tests. Antibody against one antigen can be detected in patient's serum by employing the different antigen which is heterophile to the first antigen. For example, that is the wheel Felix test. We have seen we use the OX2 19 and the K. We use the OX2 and 19 of the Proteus vulgaris and the OXK of the Proteus mirabilis. Okay, so we remember OX2 19 both titer is increased antibodies in case of the Rocky Mountain spotted fever and the African tick typhus. Only this OX19 is raised in the epidemic and the endemic, and the OXK is in the scrub typhus. Okay, so what we do, we take the patient serum and in which the antibodies have been raised, and we use the antigens of the rickets, this protease, because of the sharing of the epitope with the protease. So this is what? This is the wheel Felix reaction. Next we have is the Polygrinal test, which is done for the infectious mononucleosis caused by what? EBV. Okay, so that is we are using the sheep RBC to detect the cross-reacting antibodies. Next we have is the cold agglutination test and the streptococcal and protein test, that is for the primary atypical pneumonia. Here the antibodies against mycoplasma are detected by using the human O blood RBCs and the streptococcal Mg antigens respectively. Now, what are the factors that are affecting the immunogenicity? One is the size of the antigen. That is, if more than 10,000 delta molecular weight, that is for the hemoglobin, more potent. Better, bigger is the antigen, better is the antigen. Okay? Chemical nature, we remember protein are the stronger protein, then we have the carbohydrate, then we have the lipid, and then we have what? Nucleic acid. So that is the protein, carbohydrate, lipid, and the nucleic acid. This is a sequence for what? Chemical nature of the antigen. Then we have the susceptibility to tissue enzymes. Only substance that is susceptible to the action of the tissue enzymes are what? Immunogenic. Molecules that are not susceptible, such as the polystyrene latex composed of the amino acid, are not antigen. So, bigger the size, better the it is what antigen. And the protein followed by the carbohydrate, lipid, and the nucleic acid. And then we have the substances that are susceptible more to the enzymes. Structure complexity, polymers made up of two or more amino acids are more immunogenic. Obviously, complex structures are more. And the foreignness, this is one of the key factors which determines higher is the genetic distance between the antigen and the host, better is the antigen. So, self antigens are not immunogenic, whereas the heteroantigens and alloantigens are immunogenic. Isoantigens are non-immunogenic to those individuals who possess these antigens, but for the individuals, other individuals, they are what? Immunogenic. Next we have is the genetic factor. Now, different individuals shows different type of immune response towards the same antigen. This is believed to be due to the genetic difference. So that is what is the genetic difference. Responders are the individuals who produce the antibodies faster. Slow responders are the individual. When we talk about the genetic difference, there is some genetical makeup that responders are the individuals who make the fast antibodies, and the slow are the one who produce the antibodies slowly. All right. And no responders are the one who doesn't produce the antibodies. Optimal dose of antigen and antigen is immunological active only in the optimum dose. Alright, and too little dose will fail to activate the immune system, and too large will lead to development of the immunological tolerance. Next is the route. Now, what is the route of administration? In general, the immune response is better induced following the parenteral administration. But immunoglobulin A are better induced following the oral administration of the antigens. Now, although the immune response is better when induced by the parental antigens, but it also affects the type of the antibody produced, like antibody A are better induced from following the oral, and because antibody is obviously local antibody produced in the secretory immune system, so that is why the antibody A and IgA antibody is better induced by the oral administration of any antigen. Then we have the inhalation that produce the IgE. Then the site may also influence the immunogenicity. The hepatitis B vaccine is more immunogenic when followed by the deltoid than the gluteal. This may be the positivity of the antigen. Then a repeated dose, sometimes to generate adequate immune response, repeated dose is to be needed. Multiple antigens, when two or more antigens are given simultaneously, the effects may vary. The antibody response to one or the other antigen may be equal or diminished. Effect of the prior, the immune system response against a particular antigen is suppressed if the antibody was administered prior to that. Alright, therapeutic application, Rh negative women carrying the Rh positive fetus, anti-RH globulin has to be given immediately within 72 hours to prevent the RH sensitization, and so that the next baby doesn't have go into the erythroblastosis fetalis for the same reason, because sensitization of the mother and the next present pregnancy she will produce the antibodies that will destroy the RBCs of the baby. Now, come to the biological classes of the antigen. So, now coming to the biological classes of the antigen, depending of the mechanism of the antibody formation, antigens are classified into two cell dependent, T cells dependent and T cell independent one. ठीक है. So T cell dependent, that is a major pathway through which the antibodies are formed. That antigens, most of the normal antigens, होता क्या, T cell the antigen exposure हुआ, that antigen will be presented to the T cell, to the antigen presenting cell, which will carry these antigen to the T cell receptor that are present on the T cells. तो T cell will activate the B cell to form the antibodies, और दूसरे तरीके से वो interleukins भी release करेगा. This is how the antibodies and interleukins are found when there is the antigen exposure. Now, antigens, most of the normal antigens are what, T cell dependent. They are processed and presented by the APCs to T cells, which leads to the T cell activation. The activated T cell secretes the cytokines that in turn stimulates the B cells to produce the antibodies. Next is what, T independent antigen. What is that? There are few antigens. We have to remember the T and this T independent antigens. सब कुछ बाहर की तरफ है, that is one is the flagella, another is the LPS and the bacterial capsule. These are what? These are T independent antigens. Okay, so they directly bind, T independent antigen directly bind with that of the antibodies and causes the polyclonal activation of B cells and forms what? Antibodies. ठीक है. So biological classes of the antigens, T dependent and the T independent. T dependent is a basic pathway through which antigen is presented to the T cells. Then we have the T independent, where the classical pathway is not used. What happens? The flagella, LPS and the bacterial capsule, they directly activate the polyclonal activation of the B cells, forming the polyclonal antibodies. Now, very important, the examples of the super antigen or super antigen itself is very important. So, super antigens. Now, super antigens are the third variety of the biological cases of the antigens recently described, and they directly activate the T cells. Okay, so that is without being processed by the APCs. So what happens, that variable beta region of the TCRs appears to be the receptor for the super antigens. Now क्या होता है, antigen आया तो presented to the APC, presented to the TCR, but antigen, instead of just presenting to the APC, act as a what, bridge between the APC and the TCR. Okay, and this is what we are talking about, the super antigen. They directly bridge between the MHC of the APC and the T cells, and directly causing the activation of the B cells, causing the releasing the polyclonal activation of the B cells, releasing a lot of the antibodies. Non-specific activation T cells leads to the massive release of the cytokines, that is known as the cytokine stall, and causes the release of the interleukins. They in turn activate the B cell polygon, which leads to increased secretion of the non-specific antibodies. That is what hypergamma globulinemia. This is the super antigen that is acting as the bridge between the MHC class 2 of the APC and the TCR. Now, moving next, examples of the super antigen, various products of the microorganism behave as super antigen, and the most important being staph and the streptococcal toxins. Now, and the toxins are very important. The super antigens examples are very, very important. Now, diseases are associated with TSS and the food poisoning and the scalded skin syndrome. Now, bacterial super antigens, we have to remember the examples by heart. That is a TSST1. Next we have is the exfoliative toxin of the Staphylococcus and the TST1 of the Staphylococcus. We have the streptococcal toxin, pyrogenic exotoxin A and the C. We have the mycoplasma and two Yersinia. That is Yersinia enterocolytica and the Yersinia pseudotuberculosis. Okay, so we are having the exfoliative toxin and the SPE, then we have the mycoplasma and the Yersinia enterocolytica and the pseudotuberculosis. Then we have the viral super antigens, that is the EBV, HIV, CMV, and what? Rabies. Fungus we are having in the Malassezia fur. In the Malassezia fur. Now, moving next, super antigens. Uh, we have dealt with the super antigen. That is a very important topic. That is, they're causing direct activation of the T cell, releasing the polyclonal B cells, and the variable beta region of the T cell. T cell is the main region, and it has a bridge between the APCs and the T cells. The HIV, EMV, and the rabies, and the Malassezia fever, and the staph, streptococcus, mycoplasma, and the Yersinia. They are the major cause for the super antigen release. Now we'll talk about the antibodies. Just a minute break. We'll again talk about the antibodies now. Okay, now so we are now talk about the antibodies. Antibodies is what they are glycoproteins that is produced by what we know that they are produced by plasma cell that activate that is activated and form the B cells in response to the antigens and capable of combining with the antigen. And it was found when the serum is subjected to what electrophoresis. The serum proteins are separated into four fragments: albumin, globulin, alpha, beta, and gamma. So antibodies are located in the gamma globulin fraction because they immunologically react with the antigens, and both the terms immunoglobulin and antibody are used interchangeably, representing the physiological and the functional properties. Now, there are five classes, and we'll talk about the each classes and what are the important points to remember about the each classes. Now, antibody is what Y shape it is what a Y-shaped heterodimer that is consist of the four polypeptide chain. Okay, so what is that? What is the structure of the antibody? Now, antibody is what Y-shaped heterodimer composed of the four polypeptide chains, and we have the two light chain and two heavy chains. Okay, so we have the two identical light chain and two identical heavy chains. So heavy chain and the light chain or are bound to each other by what? By the disulfide bond, by the non-covalent interaction, salt linkage, and the hydrogen bond. And all the chains have the two ends, that is amino terminal one, and another is what? Carboxy terminal. Okay, we have NH3 and the COOH. There are five classes of the H chain and two classes of L chains. The five classes of the H chain are in antigenic distance. Each is distinguished by the gamma alpha, theta, delta. Alright, the five classes we have the IgA, M, D, and E on the basis of the heavy chains. Now, the light chain we have the kappa and the lambda. And what the important thing is to remember, either kappa is present in the light chain or the lambda. Both will not be present at the same time. So both the light chains of the antibody molecule are of same type, either kappa or the lambda, but both are not present in the same chain. Now, moving next variable and the constant regions, each heavy chain and the light chain comprises of the two regions, that is a variable and the constant one, depending upon whether the amino acid sequence shows variable or the uniform pattern among the different antibodies. So first we'll talk about the variable region. Now, variable region that is present near what? Amino terminal of both the light chain and the heavy chain constitute the variable region. So that is designed in VL and the VH. Next is the hypervariable region within the variable region. So this is the variable region that is present near the amino terminal, and there are some zones that shows the relative high variability, and such zones are known as the hypervariable regions. They form the antigen. What happens even in the antibody, there are antigen forming site that are the hyper variable regions, and they are the hotspot that forms the antigens, and that is there are three hotspot in the L and the four in the heavy chain respectively. So they make the actual contact with that of the epitope of an antigen. Now one we have is the constant region. Okay, so it constitutes the remaining part of the immunoglobulin molecule. The length of the constant region is approximately 104 amino acids for the light chain and 330 amino acids for gamma, lambda, and the delta heavy chains. Heavy chains possesses one variable domain and 3 and 4 constant domain. So heavy and the light chain domains are further folded into domains, each consists of 110 amino acid residue. Not need to remember that much about that. So we'll directly come to the hinge region. Now, in the heavy chain, what happens in the heavy chain? There are junctions formed between the CH1 and CH2, constant heavy chain 1 and the 2 that constitutes the hinge region. And this region is rich in the proline and the cysteine. And what is the importance is that the hinge region is what the flexible one, allowing the immunoglobulin to induce the different positions, thus help the antibody in reaching towards the antigen. IgE and the IgM have heavy chains do not have the hinge region. Instead, the constant region has an additional domain. So the IgE and the M do not have the hinge region, and the hinge region is a flexible region of the antibodies. So this is what hinge region. This is the hinge region that is present, and it is the flexible region of the antibody. Now, moving to the enzymatic digestion. Enzymatic digestion, when immunoglobulin is subjected to the enzymatic digestion, it generates the fragments, and we need to remember those fragments because they are again asked. Now, first one is what? Papain digestion. Now, papain, what does it do? It cleaves the immunoglobulin at a point above the disulfide bond of the hinge region, resulting in the three fragments. Now, this is how we have the antibodies. Now, what does the papain do? It cleaves at a point above the disulfide bond, resulting into the three fragments. All right. And what does do? Two causing what? Two FC fragment and one fab fragment. So what is the FC fragment and the fab fragment? Fab fragment is the one where antigen will bind, and two fab fragment and one FC fragment. This is the fab fragment where antigen will bind, and this is the FC fragment. So fab fragment is the one region where the antigen will bind, and the fab fragment where apart FC fragment where apart from the antigen, all the other cells they will bind where at the FC fragment. So resulting into what? Two fab and one FC fragment. This is on the papain digestion. Now, next is what this was about the papain. Then we have the pepsin digestion. On the papain, we had two fab and one FC. Pepsin digestion, that is what pepsin cleaves the immunoglobulin at a point where below the disulfide bridge of the hinges, resulting in the formation of the one fab fragment and many smaller fragments. So this was the antibody, and it is cleaving below the disulfide bond, releasing two fab and smaller fragments of the FC. Okay, so due to the action of the FC portion into smaller fragments. Now, one important point is that mercaptoethanol, it generates the four fragments. What does it do? That it cleaves only the disulfide bond. So this will cleaves into the four chains, that is two heavy and the two light chain. So this was it. We had the papain digestion, we had the pepsin. In the papain, we released two fab and one FC, and in the pepsin, we had what? We had two fab and the smaller fragments of the FC. Then we had the mercaptoethanol that released the four fragments, that is two heavy and the two light chain. Now, moving next, this is what the papain pepsin, that is the releasing what two fab fragment and smaller fragments of the FC. Now, what is the function of the immunoglobulins? Antigen binding. The antigen is the primary function of the antibody, and the fab fragment bears the variable regions of the interaction with the antigens. A factor that is functions of the FC region. We have the two regions, that is one is the Fab and the FC. So what is the FC? Most of the times the binding of the antibody does not result in any direct biological effect, and fixation of the complement takes place where at the FC portion antibody coating the target cell binds to the complement through where? Through the FC region. Other cells like phagocytes, lymphocytes, platelet, mast cell, NK cells, they all will bind where? The FC region. Now coming to immunological classes that are important to remember, the immunological classes and all other antibodies. Now since we are just taking the revision sessions, and I started from the basics, so I've taken this topic today. PYQs, we are already doing our special classes. So if you want to do just questions, just watch the special classes, because every day we do the PYQs on the special class for the FMG right now. Okay. So immunoglobulin classes. Based on the five type of the heavy chains, there are five classes of the immunoglobulins that we are having: IgG, IgA, IgM, D, and E. That is what gum they. Okay. Now each class can also exist as two types due to presence of the different light chain. As I already told you, in the light chain, either the kappa or the lambda is present, but both are not present at the same time. Yes. So we are talking of the immunoglobulin classes first, and the important one is the IgG. Now IgG consists of the constitute around 70 to 80%. What is the sequence? Is the gum day, that is IgG is most in the concentration of the, and it is what it is maximum. Therefore, it will have the maximum daily production. And since we need in the highest amount, so the longest half-life, that is about 23 days, and the highest serum concentration. Okay, so IgG has four subclasses, that is IgG 1, 2, 3, and 4, and the all will differ in their gamma heavy chain sequence. So what is the function? Now we need to remember that IgG crosses the placenta. IgG crosses the placenta and provides immunity to the newborn and the fetus. And amongst that, IgG2 has the poorest ability to cross the placenta. That is, IgG2 has the poorest ability to cross the placenta. Now, complement fixation, what is the sequence? It is the 3-1-2. 312 is the IgG sequence of fixing the complement. That is 312. Alright, and IgG1 and 3 bind to Fc receptor present on phagocytes, and IgG2 has extremely low affinity for the Fc receptors. Alright, so remember that the sequence is the 312, and IgG4 doesn't fix the complement at all. Alright, also IgG2 has the poorest ability to cross the placenta. Now, moving next. Now, moving next to the functions we have already seen, it also mediates the precipitation and the neutralization, and it forms an important part in the neutralization and the precipitation. Then we have the coagulation. This is the IgM. IgM will now talk about, that is the gum day. That is, now we'll talk about the IgM. It has the highest molecular weight and the maximum sedimentation rate. Okay, it is present in the intravascular compartment and not in body fluids and the secretions. What we need to remember is IgM is present as the monomer and the pentamer form. Monomer form is present on the surface of the B cell, and the pentamer form is present intravascularly. Okay, and since the pentamer form is what 5 monomer, that it has maximum Fc fragment, that is a 5 Fc fragment, therefore maximum complement fixation by IgM, then IgG 312. So when present as a membrane bound on the beta cell on the B cell, it exists as the monomer. When present in the secret form, it is a pentamer. IgM monomer units are joined with each other by what? J chain. Now coming to the functions of the IgM. Now IgM is the first antibody to be produced following the infection. So it is what? It is the first antibody to be produced that represents the acute or the recent infection. Then we have the complement fixation. It is the most potent activator of the complement as I would, because it is pentamer having the 5 Fc portion and the complement fix at the Fc region. So IgM, then we have IgG, Tinzobara. In the monomer form, it is present on the surface of the B cell along with that of the IgD. And it also takes part in the opsonization, but it is what? IgM is more 500 to 1000 times more potent than the opsonization than IgG. So important points to remember is this taking part in the complement, that is the IgM, then IgG3, IgG1 and IgG2, as well as in the opsonization is the same sequence, that is IgM more than that of the IgG. Fetal immunity is the first antibody to be synthesized in the fetal life, and it indicates the intrauterine infections. Then we have the protection against the intravascular organism, it responds protection against the blood invasion, and the mediates the agglutination, that is more times effective than bacterial agglutination. Then we have the IgA, that is the second most abundant. Alright, and IgA exists both in the monomer as well as in the dimer form. Now we have what? IgA that exists both in the monomer and in the dimer form, and IgA in serum is predominantly the monomer form. Now, serum IgA interacts with Fc region expressed on the immune effector to initiate what? ADCC. This is antibody-dependent cell-mediated toxicity. That is IgA mediating the ADCC. Now we have the secretory that is responsible for the local or the mucosal immunity. So IgA is dimeric as a pentameric dimer is a monomer, and dimer that is again attached by what? J chain. Location is predominantly antibody found in the secretions like tears, intestinal as well as respiratory tract infections, secretions. Function is that it mediates the local or the mucosal immunity. Okay, and it is effective against bacteria like Salmonella, Vibrio, and the Neisseria. Now, next we have the secretory IgA. It is secretory IgA that is synthesized by the plasma cells. All the antibodies are synthesized by the plasma cell and situated near the mucosal epithelium. The J chain is also produced by the same cell. Then we have the subclass. We have the subclasses of IgA. that is what IgA1, and the IgA2, that is 90%, and the 10% is the IgA2. IgA2 is in higher concentration in that of the is present in higher concentration than in the serum, that is IgA1, and it lacks the disulfide bond. Next we have is the IgGE, that is having the lowest serum concentration and the shortest lifespan, T half-life, and IgGE is only heat labile antibody. Okay, so it is the lowest serum concentration with the shortest half-life and the minimum daily production and the heat labile antibodies. Functions, it is highly potent and mediated hypersensitivity type of reaction, that is one, and it is seen in various allergies. Ig is elevated in what? Helminthic infection, so that is mediating what? The allergic reaction. PDF is available on the Unacademy app on the special class that I took for the this antibodies, and we have also done the PYQs for the antigen antibodies, and the PDF is equally available on there. Okay, so for the PYQs, because hardly 15 minute sessions left, and we'll deal with the antibodies. PYQs has already we'll discuss later, and from the antibody part of the MCQs that we also have been discussed before on the special class. Next is what IgG-D. Now IgG is also a member on that is present on the surface of the B cell. We need to remember that on the surface of the B cell, one we have is the IgM, another we have is the IgG-D. So IgM in the monomer form is present on the surface of what the B cell, and IgD is also present on the surface of the B cell. The thing that we need to remember is that it has the highest carbohydrate content, and the function of the IgGD is not yet known. All right. Now, antigenic determinant of the immunoglobulin, since antibodies are the glycoprotein, they can themselves function as the potent immunogens. Have a number of the antigen determinants which can induce the antibody response, and it is observed that entire immunoglobulin is not anti-immunogenic. We read that in the variable region, we have one region that is what hyper variable region, and in that we hyper variable region we have the one epitope that is having the antigenic component. So even an antibody can be act as an antigen, therefore we make the antibodies against antibodies, like the anti-human antibodies. They are against the human antibody because antibodies have a hyper variable region having the antigenic activity. Now, So coming to the next, that is the isotypes. That is what we will talk now about, the isotypes. Now we have seen that there are five classes of the antibodies, that is the IgA, M, D, and E, and their subclasses are called as the isotypes. Now they may vary in each other by the presence of what? The presence of the amino acid sequence, and that is present where in the constant region. We have to remember there is one constant and one is the variable region. Now in the presence of the constant region, presence a difference of the amino acid is what? Isotypic variation. Okay. Now isotopes that are present in all the members of the given species are similar in nature. Need to remember the what are the isotypic variations. They are present in the constant region of the heavy chain. They are present where? In the constant region of the heavy chain. Next is the idiotypes. Now they are also the amino acid sequence that is present in what? The variable region. So that is, remember like this, that they are idiots or they are present in the outer surface. So they are present in the variable region of the light chain and the heavy chain, and that is of one of the member of the species that act as the antigenic determinant. Such antideterminants are called the idiotypes. So remember, one we had the isotype where that are present in the constant region is the isotype. Then we have the idiotypes present towards the outer surface, that is the variable region of the heavy chain and the light chain. These are what? Idiotypes. And such variation between immunoglobulins are due to a difference in the amino acid sequence and is called idiotypic variation. And idiotypes in an individual arise continuously from the mutations. Hence, idiotypes may act as a foreign to host itself. Now, next is very important one, that is what? The allotypes. Now, allotypes are the present in the isotype genes in the constant region only of the heavy and the light chains that encoded by what? Multiple alleles. So, allotypes are a type of the isotypes that are present in the constant region, but they are encoded by the multiple alleles. There's A for A, that is a multiple alleles. Although all the members of species inherit the same type of the isotype, multiple alleles exist for the sum of the allele genes. Hence, allotypes are present in the constant region. So, we have the isotype and the allotype that is present in the constant region, and then we have the idiotypes that is present in the variable region of the heavy and the light chain. Differing in what? Amino acid sequence. Now, the allotype system to date, three systems of the allotypes have been known till now. That is, one is the kappa light chain, and we have for the gamma heavy chain, alpha heavy chain. Antibody to allotype determinant can be produced by injecting the antibodies. Now, talking about the abnormal immunoglobulins. So, abnormal immunoglobulins now, in addition to five classes of the normal antibodies, we have structurally similar proteins. Now, first important abnormal immunoglobulin is what? Jones proteins. Okay, and they are produced in what? Multiple myeloma cases. They are what? Multiple myeloma, that is, they are what? Neoplastic conditions. So this condition is called as the light chain disease, and the cancerous plasma cell exclude a light chain, that is the Jones proteins. They are light chain proteins which are accumulated, light chain proteins which are accumulated where? In the patient's serum. Now, such have the unique property that they are coagulated at 50 degree and resolve again at redissolving again at 70 degrees Celsius. So, what is that? 50 degree they will what? Coagulate and redissolve again at 70 degrees Celsius. So, that is, we are talking about the Banks-Jones proteins. That is what these are. They are the light chain proteins and formed in the multiple myeloma found by the plasma cells and coagulated 50 degree and dissolving at 70 degrees Celsius. Yes, every day, almost every day we take the FMG classes. The schedule is mentioned in the this channel only, and you press the bell icon so that you get the notified whenever the class is about to start. Now, coming next, what type of the abnormal immunoglobulin we are talking about? One, we read about the Benz-Jones proteins. That is what formed where in the multiple myeloma by the plasma cells, and that got coagulated at 60 degrees Celsius and redissolved at 50 degrees Celsius, redissolved at 70 degrees Celsius. All right. Next abnormal antibody we are having is what Waldenstrom's immunoglobulin. This is formed in the beta cell lymphoma, and we are having excess of IgM. Okay. Next is what heavy chain disease, which is why from the name itself that is excess protection of the heavy chain, and the cryoglobinemia that we see where in the multiple myeloma and the hepatitis C infection. So this is about the abnormal immunoglobulins, Benz-Jones proteins and the Waldenstrom's macroglobinemia. Then we have the cryoglobinemia and the heavy chain disease. So coming to the next, that is the monoclonal antibody. I have already taken the marathon sessions for the FMG PYQs and random questions for the FMG previously asked questions. We did 2 2 hour PYQs marathon sessions in last 3 4 days. Please do see watch that as well, so that will help you more in the practice of the PYQs, because right now we are discussing the theory, and in that we discussed about the high yield points of every topic, and we did the marathon PYQ. So you can just watch that and make yourself question practice. Now, coming to the next set is the monoclonal antibodies. Now, monoclonal antibodies, they are derived from the name itself, monoclonal, that is derived from the single clone. Monoclone, that is a single clone of the cells, that is derived from the single clone of plasma cells. Okay, and it is produced against a single epitope. What was the epitope? Is this the smallest antigenic variant of a antigen? That is what the epitope. Now we have the polyclonal and the monoclonal nature. Polyclonal is what, that is the more than one type of antibodies, that is a mixture of antibodies is present. All right, and derived from the different clone of the B cells or the plasma cells. This is the polyclonal. Now, when an antigen having the multiple epitopes, such epitope may stimulate one clone of the B cells, producing one type of the antibody. This is the monoclonal. The resultant antibody mixture present in the serum is said to be polyclonal if they are produced by what different clone of the B cells. However, one clone produced is stimulated against a single epitope, then it will form out monoclonal antibodies. Now, the technique that is very famous for the monoclonal antibodies, that is what the hybridoma. Yes, you will have to search on the Unacademy app by Dr. Muskan Chaudhary, and you will get the microbiology list of the sessions that we have taken. I have taken on that, and you will get the FMG PYQs by the name of the FMG PYQs. Now, production of the monoclonal antibodies, that is hybridoma technique. Now, monoclonal antibodies are produced by the hybridoma technique that was developed by the Collar and the Milstein, for which they were awarded a Nobel Prize. And the principal A clone of the B cell stimulated against a single epitope is fused with the immortal cell, that is the myeloma cells. What are the points that we need to remember in the hybridoma technique is that one is that we use what? Just a second. I must be having the table. The hybridoma cell has two unique properties. That is, one is that they will produce the monoclonal antibodies, and second is that they will multiply indefinitely, producing the clone of the identical cells that is required for us to form the antibodies. Now, the steps of the hybridoma, first is that splenic cells. Now, the mouse is injected with the antigen. Okay, whatever the antibody we need to form, first we'll inject the antigen in that of the mouse so as to sensitize the spleen of the mouse, and that will form the antibodies. So what we do is that we inject the mouse with the antigen, and after interval mouse will form the antibodies. Okay, why we use the mouse splenic cells? Because the mouse splenic cells are the immortal cells that continuously divide. So they are a type of a cancerous plasma cell that continuously divide, and they are compatible for the fusion. Now, hence myeloma cells are genetically modified, so they can lose the ability to produce their own antibody but retain the immortal property. So the basic purpose of using the splenic cell is because they are continuously dividing, multiplying cells. Therefore, we use so that we can have a cell that can continuously multiply and form the antibodies. Now, the mouse splenic cell is fused with the myeloma cells that will form the antibodies and fused in the polyethylene glycol, and we get to infused myeloma cell, unfused splenic cell, and the fused hybridoma cell, which is of our use. Now, how to select which one is fused, unfused cell? That is in the HAT media. Okay, that is the hypoxanthine media that we use for the hybridoma cells. That is the HAT media, that is hypoxanthine, aminopterin, and thymidine media. That is what HAT media. So once mouse cell has been fused with the myeloma cells, we need to select the true hybridoma cells that has fused. So how do we do that? We make them grow in the HAT media, that is hypoxanthine aminopterin thymidine media, and purine synthesis in the mammal occurs by either de novo or the salvage. Now, now, any salvage pathway requires two important enzymes. One is the HGPRT. What is the use of the HGPRT? Now, in the HAT media, the fused cells, we segregate that, and in case in that of the HGPRT media, myeloma cells lacks the HGPRT media, and the unfused myeloma cells are further segregated because they cannot grow in the HGPRT media. So this is how we have selected out. If the original antigen used as a multiple epitopes, many B cell would fuse and produce a mixture of the hybridoma cells. The hybridoma cells produce the desired molecular antibodies required by the affected by the radioimmunoassay. Now, for the maintenance, hybridoma cells is cultured to generate clone of the identical cells. Alternatively, the desired hybridoma injected into the peritoneal cavity of the mouse, where it can multiply and produce the monoclonal antibodies. But what happens that molecular antibodies that has been obtained from the mouse acidic fluid may not be in the pure form. So hence it is purified by the chromatographic method. So what we need to remember, one, we need to remember the HAT media. Another, we remember HGPRT enzyme that is important for the growth of the fused cell to form the purine, and the salvage pathway in which the myeloma cells doesn't grow alone. Now moving to types of the monoclonal antibodies. Actually, the playlist is already made by the name of the FMG. by the name of the FMG. So you can just scroll into the channel, and by the name of the FMG, you will get the all the playlist of the lectures that you have taken on the YouTube. Okay. So now coming to the types of the monoclonal antibodies. The above mentioned procedure would yield about 100% the amino acid that are mouse derived. So we have the type. Why we need the other types of monoclonal antibody? Because they are mouse derived, so they can cause an allergic reaction in the human. So one is with that we are having the mouse monoclonal antibodies. Another we have is what chimeric antibodies, that is a combination of the mouse proteins and the human proteins. Another, from the name itself, there is the humanized molecular antibodies, that is majorly the human derived, and then we have the human, that is 100% human derived, and it's the best acceptable monoclonal antibodies. Now, what is the application? And the molecular antibodies can be used to purify the individual molecules from a mixture. And example includes involvement of the T helper and T cytotoxic cells that are identified by using the anti-CD4 and CD8 antibodies. Then we have the diagnostic. The wider application is the detection of the antigens, because they are forming the antibodies, particular antibodies, and therefore for detection of the antigens in certain disease, and by using the various ELISA and the rapid test. For example, in the case of the hepatitis B and the streptococcus. Monitoring of the proteins and the drug levels in the serum, and for the passive immunity for the post-exposure prophylaxis, like against the hepatitis B and the serum, rabies and the tetanus. Therapeutic use for the inflammatory certain allergic disease, and used as a immunotoxin to kill the target cells, just like the cancer cells. All right. Now, antibody diversity. Now, antibody diversity is a mechanism by which human system is capable of producing a vast number of the antibodies. That's one is the multiple chromosomes. Now, please remember that heavy chain is present on the chromosome number 14. That is again a question. While we have the K and the lambda chain, kappa and the lambda is on the chromosome number 2 and 22. Okay, so we have to remember this. On the 14, we have the H chain, and on the 2 and 22, we have the kappa and the lambda. So we have already seen that is the gum, there is the mnemonic for the serum concentration. G is the highest concentration with 23 days of the T half-life and the maximum daily production. We have the sequence of Mg 312 for the complement fixation, and for the opsonization also Mg. Okay, then we have the IgA, which is present in the dimer and the monomer, and that is a local secretive immunity. And remember that is can activate the alternate pathway. Then we have the IgM, that is the highest molecular weight in the monomer and the pentamer, and it is mainly responsible for the activation of the complement. And the Ig for allergy, and also the monomer component of the IgM is present on the surface of what B cell, along with the IgD and IgM. Then we have the IgGE, and that is responsible for causing the allergic symptoms. And one more thing, IgG crosses the placenta, but IgG2 is the poorest when it comes to crossing the placenta or fixing the complement system. So this is the pentameric form, and since it is having the FC portion, it is having the FC portion highest, so it is what major fixation for the complement. All right, and it has a valency of the 10. How do we decide the valency of an antibody? Number of Fab fragment is equal to number of valency. Since IgM is what pentamer, तो इसके पास 10 फैब फ्रेगमेंट हो गए, तो 10 वैलेंसी हो गई. Alright, highest carbohydrate content that is present in the IgD. So I guess we are done now. Let me see. So we are done. Just a quick 5-minute revision. I'll not take much of the time, more than 5 minutes. We are done with that. Immunity 2 types, innate and acquired. What you'll directly see is the graph. ठीक है. So components, remember, components are NK cell, and then we have gamma T cell, NK cell, B1 cell, mast cell, dendritic cell. And complement pathway, what we need to remember, alternate and MVP are the innate and others are the alternative acquired one. ठीक है. And then we have the other component, that is the resident flora and the cytokines, and the TGF, TNF, alpha, beta, and the APRs. We need to remember the positive and the negative examples. Positive one and the negative one, albumin, transthyretin, and the this transferrin. Then with the CRP, remember the level. It is normally it is point less than zero point 0.2. If it is zero point 0.2 to 1, then common cold, pregnancy, and the exercise. 1 to 10 is present in the BCP, that is the bronchitis, cystitis, and the pancreatitis, and more than 10 is present in the major trauma and the this bronchitis. Now, we acquired, and the immunity component for the acquired is the interleukin 245 and the classical complement pathway and the T and the B cells. All right, response you have seen. Active immunity, natural, passive, and so is the prime. We need to remember in the primary and the immune secondary. IgM is the first antibody to rise here, the IgG. All right, and you have the lag phase and the latent phase. Here it is either absent or decreased, and it is more potent. Second immune response is more potent and more because of the higher antibody concentration, and it has what a negative phase. Okay, then we have the secondary immune response. That one is a negative phase we have already seen. Now, passive immunity, that is a natural and the artificial one. Natural one by the mother to fetus, and that is the IgG, and the passive in case of the toxins, toxins that we give the rabies. And now, bridge. Remember the names of the bridging cells, that are cytokines, dendritic cells, and the classical and the complement pathway. So herd immunity and the local immunity by the IgA. Herd immunity when more than 70% of the people are what immunized. Now, adoptive immunity we see in the lepromatous leprosy. Okay. Now moving next, antigen. We have the two-part, immunogenicity and antigenicity. Both are important. Immunogenicity is inducing the immune system. Antigenicity is combining with those cells. That is the ability to bind with those cells. Now, moving next is what the haptins, that is our incomplete antigens, because they are what, why they are incomplete antigens, because they are incapable of immunogenicity. Okay, so they need the carrier proteins. Then we have hydrophile antigens, wheel Falix reaction, Polygrinal test, and the cold agglutination test. Now, biology classical, T dependent, T independent. Remember the examples: capsule, flagella, and the LPS. That is what T independent antigens. Important one. Super antigens that directly activate the T cells and by the variable beta region of the T cells. And what else we need to remember? The examples: TSS, food poisoning, SSS, and Staphylococcus TSST1, and the exotoxin, enterotoxin of Streptococcus, Mycoplasma, Yersinia. Then we have EBV, CMV, HIV, and the rabies and the varicella. Structure, we have antibodies we've already seen. We'll come directly to the important points. Two heavy chain and the two light chain, and the kappa and lambda light chain both are not present at the same time. In the papain digestion, we get two Fab and one FC. In the pepsin, we get two Fab and the smaller fragments. And the mercaptoethanol, we get two heavy chain and two light chain. All right. So thank you for today's session. We are done now. It was a long session, so please press the bell icon, do like, share, and the comment, and use my code, that is what Muskan 10, to get 10% off the discount. So I'll see you soon in the next session. Alright, so use code, that is Muskan 10 to get 10% off the discount. And I will see you soon in the next session. And that is probably at the 9 p.m. tomorrow, and we'll talk about the virus now. So I'll see you tomorrow, and do like, share, and subscribe. And I hope that you must have given the NEET PG combat and performed well, and you must have gotten the scholarship based on the NEET India PG, this NEET All India rank. So do not miss this type of the examinations, because you clearly get perks of attending those sessions and doing the just a one 45 questions are asked hardly, and 1 hour session is there, and you easily get 20,000 vouchers, rupees 20,000 of the vouchers. So see you soon, and take care until